Hi, Christine.
Hey, Alyssa, how are you today?
I'm doing well. How are you?
Not too bad, not too bad.
Excellent. Well, I'm really excited to talk about ANF therapy, immunoneurofrequency therapy, with you, something that you introduced me to. And actually, I just got my first experience with this yesterday. Not even for myself, and I wish she was in here so I could show you, but my dog Nikita, because
Yeah,
as you were explaining, the human systems are very similar to animals. So it's uh it's something that we're trying for her arthritis, her chronic pain that she's dealing with right now.
yeah. So ANF is one of the really wonderful things about it. Anything with a nervous system, you can help. ANF therapy was actually developed by, he's a Swedish doctor, Dr. Mikhail Hoff. He lives in Spain now, but he actually does a lot of work in the Middle East, and camels are really big in the Middle East. And he has protocols that he's designed just for camels, because anything with the nervous system, 'cause that's a major area that we're targeting with the ANF. So it's really quite fascinating.
That's awesome. Yay. So before we start talking about kind of what it is and what it looks like and that sort of thing, can you talk a little bit about like some of the, people that you've treated or some of the things that you've seen this help people with particularly?
Sure. Yeah, I almost feel a little funny sometimes when I talk about ANF, because it almost sounds like one of those things that's too good to be true, because you really can work on just about anything, because at the root cause of our disease, pick your disease, arthritis, it's an inflammation, cancer, heart disease, they all have inflammation at their root, at their base, and that's what we're going for, is the root. So I started getting into ANF, probably about 3 or 4 years ago. I don't remember how I had heard about it, through one of my circles with the work that I've been doing. Um, and honestly, when I first heard about it, I thought it was the craziest thing I've ever heard. I didn't buy it one bit. You couldn't have been more skeptical than myself. Um, but I took the course because I really respect and admire the man who was teaching it at the time. And he's like, take the course. Okay. And it was 4 hours away. I'm driving to the course. I'm thinking, I am wasting my money. This is ridiculous. And the first course is, there's four days for it. We have 8 courses altogether that we do when you're going through ANF. And you spend the first half of the 4 days really learning biochemistry of the body, theory of the discs, how they work, how the nervous system works, lymphatic, and all of that. And then you spend the other half of each of those 4 days treating people. People come in as test patients. So you don't know who's coming in, what issue they're dealing with. And we started working on people. I still really had no idea what I was doing, frankly. And but I started seeing it work. And I was like, all right, I don't get this, but I can't argue with what's happening over there. So that really got me on the ball with this, and kind of learning to look aside from my skepticism and find out, what is this really about? And it's really fascinating work.
Yeah. So what are some of the things that people were coming in for that you were seeing change?
So I've done a lot of, certainly work with people with acute pain, like if somebody broke their ankle or something like that. All of those acute orthopedic injuries, those are actually really easy to address. It doesn't sound it, but they're super easy. You get down the inflammation, the pain is the very first step. Then you work on a healing process. My work, I tend to focus a lot with people with autoimmune issues. That's kind of a near and dear to me. People in my family I know that have autoimmune issues. This is what got me on the path to this, because nothing helps them. People with fibromyalgia, for instance, they've done everything under the sun. They've done the nutrition, they've done the exercise, they've gone to the best doctors in Boston with some help, but never really getting, it's always coming back. And that's really where I focused my work. I work on a family member who actually was in bed, couldn't get up, going to take a shower was, that's it, I'm exhausted, that's my day. To now can lead a normal life, really, can deal with the stressful situations, which for her was a big trigger, which would set her back and she'd be bedridden. Goes through the stressful situations and is fine. I don't want to paint the picture that it's a one-shot deal. It's a progression. Autoimmune issues are also a progression. It takes a little bit of time to get to that point in your life, in your health history. So it takes a little bit of time to kind of back down that road as well. But just phenomenal results with that. And fibro is, again, really near and dear for me because of family members that have it. And also I hate seeing people that really have lost hope because they've tried everything and nothing works. This works.
Yeah, yeah, that's interesting. So I know for me and for what I know of the therapy that there are the discs, right?
Mhm.
Are you wearing any right now? Do you have them on your finger still?
I have them on my finger. I broke my finger, so talk about that's kind of again an easy fix. So fingers are hard because you don't have a whole lot of real estate. I'd like to have a few more on there, but my fingers are only so big. But really taking down the pain, the inflammation, some of that swelling I want in there because I had a traumatic event. I broke the bone. So inflammation is part of the normal healing process. Where it's problematic, I know you and I have spoke about this before, is when we get that chronic inflammation. So I don't want to take down all of that inflammation because it's my body doing what it should. So I've got them there, but I have some others on my liver and such that I won't show you all. But this is what the discs look like. I don't know, can you see them okay?
Yeah,
Little round, they're very flexible. Okay.
they look
So
like
each of,
little yard sale stickers, little yard.
yes, kind of like that. They look really simple. And it's one of the things that I think kind of stumps people. So like, oh, how can that sticker do anything? But they're a medical device. They're a medical class 1 device. They're approved by the FDA. They're approved by WADA. So what they are, each disc, we have, over 280. I think we have maybe close to 400 different discs now, depending on what system in the body we're targeting, whether we're looking at an organ, muscular, nervous system, lymphatic system, and also different frequencies in them. Each disc has an individual frequency embedded in it because everything in the body works on frequency. That's how we are electrical beings. You know, if somebody has a heart attack and they use the paddles on them, they're shocking the nervous system. They're not shocking the heart. It's that electrical impulse. We are electrical beings. So depending on which system in the body we want to target, we'll use that, helps us determine which disc that we're going to use. So what they do, they'll stick on with it's a 3M backing, very similar to what they'll use in surgical tape, that same sort of backing, and they just stick on the body. So each disc is activated by heat, any heat source. Heck, I could stick it on your cell phone and the disc will be activated. You'll get no results from it, but your cell phone will. So your body heat will activate the discs. And the frequencies within the discs are picked up by your neurons and transmitted to your nervous system. And your nervous system will replicate and reflect that for self-correction, which is one of the things I really love with these because it helps you get to the root cause. Let's get to the root cause instead of treating symptoms, because symptom care in a way is nice. Oh, my shoulder hurts and that shoulder pain's gone. That's great. But if I don't get to why is that hurting, chances are really good that that shoulder pain is going to come back because I kind of just put a Band-Aid on. And sometimes we need a Band-Aid. But let's get to the root cause so I don't have to keep doing this. I don't have to keep going to massage or keep going to the chiro or the doctor or the PT. We need to get to that root cause. And this will do it. It allows the body to self-correct, which is fabulous. No drugs, no chemicals, which again, have their place. I'm not anti-medicine at all. I think there's a time and a place, but if I can minimize the amount of chemicals, the amount of drugs that I'm putting into my system, I'm all for it because they take a toll on our body as well.
I love that. It's so cool because it's almost like you kind of get the benefit, that acute relief. Like even when you were putting the disc on Nikita yesterday, you tested some of her trigger points before and after, and we even saw a result immediately in just that pain.
Yeah.
So what's so cool is that, like you said, like you're able to then do that to kind of see what other work has to happen, because what happens, right, is that pain, and we kind of talked about this a little bit last week too with Lisa, that pain ends up taking so much of your energy and your attention. It takes away from your body's ability to even really be able to address what's going on, because it's like it's like sensory overload almost.
Yeah, you'll definitely get that. And each body, we have a finite number of resources within the body. So those resources are going to be prioritized. The body has a hierarchy. The most important thing to the body is stay alive, not to feel good, not to move well. Those are important to me, but more important to my body, if I could separate the two, is I'm alive. I feel terrible or I can't walk, but I'm alive. So my job is done. So my body is going to take my resources to keeping me alive. So what we're doing with the disc is we're helping to optimize the resources that are in the body. So all of those other functions, staying alive is important, but I also want to feel well, and I want to be able to move. I want to be able to play with my kids or throw a ball or go for a run or whatever your thing may be. So we're optimizing all of those resources so we have health versus just being alive.
I love it. That's awesome. And I think that's so much of what we've been talking about this whole month too, is we really need that foundation. We really need that strong foundation to bring in as many resources as we can to be able to take on that next step, right? And to be able to go that further. So we need to surpass just being alive, right? And realize that there's all these other places to go from there.
Being well. Yeah.
Yes.
Yeah.
Yes. Yeah. Unfortunately, the not feeling well is sometimes what gets us into start looking at these things, but that it really is. I remember talking with somebody once, saying how her, her anxiety was a blessing because, it caused her to pause and look at everything else happening around her to, really realign things to how she wanted it to be. And without that, panic.
Save her pause. Yeah.
Right. Yeah. Then it's never addressed. And it's kind of similar. Your body is doing things like even the example of your inflammation in your finger. That's what your body is supposed to do in that situation so that it can heal. So, we're helping the body to do what it needs to do on a basic level so that we can really keep rising above. And like you said, be well, right? Start to thriving. Yeah. It's not just all about healing, right? But there is thriving on the other end of that.
Thriving. That's the perfect way to put it. Yeah. It gives you, when you start looking at the body and looking at like your friend that you were mentioning, or, I sprained my ankle, it slows us down, obviously, because it hurts. It's, kind of gives a new meaning to the term body language. Bodies really do talk to us if we know what it's saying, know how to listen to it, and we listen to it. So often we don't. We just push through, oh yeah, I'll do that later, or yeah, I've got to, especially for women, I think we tend to, I've got to take care of everybody else before myself. Yeah. Bodies give us a lot of signs and symptoms, and sometimes those are really easy to read. Sometimes they're a little more challenging if you're not trained in it. But I always tell my clients, and I think they think I'm I know they think I'm a little wacky, but pain is really your friend. I don't want to hurt any more than the next person, but pain lets you know something is wrong. Hopefully we listen to that and stop before it really hurts us or really stops us in our tracks. Yes. But so often we don't. And it's the body will let you know what's going on. It's knowing how to interpret that information.
Right. A little true. Sometimes we just need a translator, right?
Yes, absolutely. We all do.
Yes, I love it. Awesome. So when you're doing an A&F session, obviously it's going to vary in length and how many discs the person needs and such. But so what does a session look like, in terms of like cost? Like, is it an expensive treatment?
So you hit on the key point. It really does depend. And I hate to give that answer, but the way I work, I try to be as conservative as possible. I could throw a whole bunch of discs at you, but then I don't know which ones really are helping you and which ones you don't so much need. So why do that? And also, I'm aware of the financial issue for people. The discs are only $4 per disc, so that's affordable. We try to keep those costs as affordable as possible. A typical session, if there were such a thing, and it really depends what somebody's coming in for. If I'm dealing with an autoimmune issue versus an acute orthopedic issue, they're two very different sessions. But in general, what a typical session will look like is I do a very thorough intake with people, a very thorough assessment. I'll talk to someone, find out a little bit about what their complaint is, what's going on, what symptoms they're feeling, the history behind that, even history way back when you were 3 and you fell out of your treehouse. I want to know that sort of thing because we compensate along the way. And we've all had things happen to us. And then I will do things like, I'm going to look at your skin. I'm going to look at the color of the whites of your eyes. I'm going to palpate, kind of poke around different areas, feel what's the tissue like, that palpation resistance. I'm going to feel for certain organs, take a look at just the quality of the skin, the tightness of the skin, all of those sort of things. I'm going to watch you move. If it hurts you to, let's say, do a squat, I'm going to have you do one. not to pain, but I want to see how you move. What are you compensating with it? All of those sort of things. And then generally we'll go through and we'll start applying the discs. And you kind of alluded to this a little bit earlier with the work with your pup. One of the really nice things with these discs is we know if they're working in that first session. I don't really know of anything else that gets those kind of quick results, because your pain, if I do my job correctly and I pick the correct disc and I place them correctly, you should notice a reduction within that first session. So I'm not saying your pain, let's say it's at a level 10, will go down to a 0 in that session. That would be nice, but that's probably not realistic. But if I can get your pain from a 10 to a 5 in 15 minutes, that's pretty darn good. I don't know of anything else that does that. And with the discs, we'll apply them, and then I'm going to go through and I'm going to reassess. So like you said with your dog, she had that one spot that really made her yelp and kind of turn quickly. I was a little afraid she might bite me, but she didn't. She's cute. Your pain will go down if I've done my job correctly. If not, I'm going to take that disc off of you, because I don't want to send you home with something that doesn't work. I'm not going to charge you for something that doesn't work, and we're going to get the correct one on you. So that's really nice. So we know right away when we're on the right path, or nope, I need to reassess and figure that out. What did I miss?
Awesome. That's so awesome. I love it. I love that technology is getting to this place. Something so, it really is so simple, as complex obviously as those little things are. It really is so simple. And I imagine, I mean, I know you treat yourself all the time. I imagine if you know what your problems are, what your triggers are, like seasonal allergies, for example, and you know where, I could see how maybe it would be easy for, like, do any of your patients or clients, just kind of help themselves once they've known what they're doing for a long time.
Usually what I'll do is I'll have someone come in for that initial session, and then the disc will actually last for 72 hours. So you're getting 3 days of continuous therapy. You wear them continuously. You can shower with them, all of your daily activities, absolutely fine. Kind of like a laser is a frequency therapy. But once I take that laser pen off of you, you're obviously no longer getting that input. With the disc, you're getting 3 days of continuous therapy, which is really cool. So after the 3-day period, 3-4 days, I like to get people back for that initial visit. We'll reassess, make any adjustments I need to make. And then what I'll do is I usually send people home with a change out of discs that you can do yourself. So it saves you the time from having to come back into the office again, because everybody's schedule is busy. I know that. It also saves you the expense of an office visit. Changing the discs is very, very easy. Really, they stick on like a Band-Aid. Again, it's that 3M backing. They just stick right on you. The tricky part, where the knowledge part comes in with this, is all of the assessment. So we do that. And then you just tick one off here. I'm going to put one on here. I give you the new ones. I draw a little map for people where to put one and label them and all of that. So it's very easy for people.
That's awesome.
And then I usually have them come in maybe once a week after that, depending on what we're dealing with.
For sure. Oh, that's amazing. I love it. Yay. All right, cool. Well, if anybody, I know we have a couple people watching. If anybody has any questions, feel free to pop them in. But otherwise, this has been very informative. I mean, I think something that really not a lot of people have probably heard about or experienced themselves. So so happy that you are so knowledgeable. And actually, Christine teaches this too for other therapists.
I do.
So if there are other therapists or other practitioners, I imagine chiropractors probably. Maybe
we have a lot of chiropractors, PTs, MTs in the class. I actually have a class coming up in Rhode Island in October. If anybody is qualified for that, just reach out.
Yeah. So it's something that people can learn too. And Christine, you're operating now in your space in East Providence. But Christine's going to be coming down our way in East Greenwich, integrated wellness. So we'll be able to offer this down this way soon, which we're so excited about.
Super excited.
Yeah. All right, great. Well, everybody, thank you so much for watching. Please feel free to drop your comments or questions for Christine, and like it, share it, help us keep spreading the word of all this good stuff. And I imagine maybe we'll be able to talk about this again next month when we get into gut health.
Oh, huge in the gut.
Yeah. So more to come there. All right, great. Thank you so much. Have a great rest of your day.
Thanks. You too. Bye, everybody.